So to fast forward, you were successful in the entertainment business. You created a company called Entertainment Resources. You eventually sold that business, and then you decided to go into an entirely different field, a new domain for you, which was healthcare. What was the reason why, after spending so many years in entertainment, being successful, getting liquidity, having a little cash in your pocket, why did you decide to go into an entirely new industry for you, healthcare?
Yes, and so after I sold that business in 2005 and had developed the domain expertise and really more into just being in a space that was highly disruptive, I looked and saw where would I be able to apply those similar domain expertise of disruption and technology and rapid change. And I looked carefully over about a year and decided that I thought that we could apply that and I could apply those expertise into healthcare.
So in 2009, you co-founded a company called MD Live Care, and my brother David Scully and I, who are advisors and investors in you now, we met you in 2012. And at that point, you had defined the vision of telehealth. You believed that telehealth was going to become important. Why did you think it was going to become such an important industry?
Well, first I looked at the space as a potential investor and wanted to understand what types of businesses, both on technology and services, that had existed, and if there would be something to potentially buy versus build from scratch. And after doing that for about 6 months, I came to the conclusion that it was very early inside the timing of being able to deploy a business like that, and that it would be better to absolutely look at building that versus buying it. And I also identified that the way that healthcare had approached both the way it would, from an efficiency perspective, didn't exist. And so I was encouraged about that opportunity.
Now, the healthcare industry traditionally in the U.S. since the end of the Second World War has been an employer-based health insurance benefit to workers in large organizations. There's something like well over 100 million workers are covered by a tax-free benefit given by their employers, created by Congress at the end of the Second World War for the returning GIs. And then in 2013, a new entitlement program was created by the government called the Affordable Care Act, went into effect in 2014, and it changed the ground rules for how a lot of people are thinking about healthcare and opportunities. And one of the important ones that you recognized was that the insurance industry was changing their models because their big customers, the employers, were going to self-insured because their risk pool of their employees was a lower cost risk pool than the general population, meaning that they didn't have to carry a lot of the chronic care health people who are near end of life, and they could focus on the employees and their families. One of the big outcomes of that has been a dramatic shift to self-insured employers, and that these self-insured employers are changing the policies and making them higher deductibles, which means for the first time in the US that people have to pay attention to what health care actually costs, because the co-pays weren't kicking in at the low levels that they were previously, where they might be $1,000 co-pay deductible each year. Now it could be $5,000, $6,000 of deductibles before your co-pay kicks in. For the telehealth industry, this was a game change opportunity, because it suddenly meant that people were going to pay attention to what healthcare costs, and that the wait time for getting a doctor appointment face-to-face was extending out, as up to 30 million people were being added to the health insurance rolls. Tell us a little bit about what that meant to MD Live and how you thought about how you wanted to build this business with those external events that were going on in the broad healthcare industry.
Exactly. One of the things that we always thought is that we were not specifically going to go into the telehealth space, but we were going to go into the healthcare delivery space. We were going to use technology to do that, but we also didn't want to be in a situation where the telehealth side would be fragmented. And we saw that there would be a requirement to absolutely use technology in online care as a way for people to connect, but making sure that ultimately that the online care access and the physical care access were connected. And so that sometimes it would be appropriate to use the technology and sometimes they would need to absolutely be seen physically. And we actually, in doing so, we decided that the important thing for us would be to become provider and health system centric and to work to build a national and then ultimately global integrated delivery network of healthcare providers that we could connect to the technology so that consumers would have that capability to both access providers both digitally and then also be able to see them physically as well.